In your health headlines, winter is here, even in San Diego, and that also means cold and flu season is here as well, and we all probably know somebody who is sick. Everyone around where I was working today is passing out lozenges, and so what can we do to minimize the symptoms? Dr. Mitchell Goldman with UCSD is here now with some tips. Hi, Dr. Goldman. Thanks for joining us.
Good to be here, Susan.
Okay, so I'm sure you're seeing it too,
Yep.
and I think the number one thing is that you start to get that little feeling, the feeling in the back of your throat. You know the symptoms, you know what's coming. Can you do anything to stop it?
You actually can. There's a number of things to do. The first one is, of course, get plenty of sleep, because what we want to do is build up our immune systems. And people have found that if you get a little bit more sleep, the immune system actually responds better. Also, cut down your stress, because stress is also going to decrease the immune system. And finally, it's okay to exercise. Actually, exercise can actually increase your body temperature, which can help kill the cold virus. So the only time you shouldn't be exercising is when you have a fever. But if you don't have a fever, get out, do some exercising, raise your body temperature up, and that'll actually cut the cold virus down.
And people also want to know, you're wandering the aisles looking at all the cold medicine. What should you take? Should you combine both things? And should you also do nasal spray? A lot of people just swear by nasal spray.
Yes, those are all good points. Actually, nasal spray, a saline spray, is actually very helpful. It'll actually wash out a lot of the cold virus, again, helping your body take care of itself. But what people don't realize is probiotics are also very good. Probiotics can actually decrease cold symptoms and signs for about 2 days earlier. So it makes a cold go away 2 days earlier. And then finally, you can also do things like coumarin and turmeric, which are basically some spices, which also can cut the cold virus down.
Okay, so drink plenty of fluids. What's the apply pressure? What's that part of it?
That's something that's a little bit more interesting and holistic. And there are a number of pressure points between the eyes and just medial or to the eyebrows and around the nose and on the neck that can actually help to stimulate your immune system. And so although those are not as commonly done, just little pressure points here, behind the neck, they can also help to stimulate the immune system and make your colds go away a little bit more quickly. But you know, fluids are very important. In addition to chicken soup, it's water, because that'll actually decrease a lot of the mucus and allow you to cough it out.
Have you heard from people who say they get rid of it, or they think they've gotten rid of their cold or flu and they feel better, and then all of a sudden it's back again?
Yeah, and that definitely does happen a lot. And so again, if you have a fever, that's not when you want to exercise, but exercising is really good to try to prevent the colds from coming back. Sleep, decrease your stress. Those are the most important things that we can do.
And how about the antibacterial stuff? Is that worth it?
You know, yes and no. I would say probiotics are much better. But you know, one of your first points was, should you mix things like antihistamines and things like Tylenol? And the answer is no. If you have a runny nose, that's when you should use an antihistamine or a decongestion. And if you have headaches and feel feverish, that's when you should use things like Tylenol or ibuprofen. But most doctors don't recommend, and I don't recommend, having these combination medications.
Okay, good to know, good information. Thank you, sir. Have a wonderful holiday.
Good to be here, Susan.